Well, my head was. My head was. But then they said it didn't stop rolling. Couldn't play behind it. This whole year, somebody to the side. I can't have it.
Me?
Good evening. The time is now 6:35. I call the regular Board of Directors meeting of Jasper Hospital District to order. Record show that tonight we have Judge Kennedy, Dr. McMurray, Reverend Horton, H. Matthews, Reverend Harris, Michael Dexter, and Kenneth Bush present, Board Attorney, Robert Jackson. Also present that we also have the hospital administrator, Mr. Moore. At this time, I'm going to ask Reverend Horton. You all right?
We may bow here, oh God, helping edge is fast. We ask that thou would help us right now to let us know that you're going to be by our side. I mean, what we do be accepted in thy sight. Let the decision that we make be one that you can receive, and I know if you got it in your hand, we can settle for whatever you give us. I bless our president and bless our board members. I mean, we work together in harmony and in love. For us in your name we pray. Amen.
Amen. At this time, we up to our public comments, and we do have Ms. Goldman present this evening. She signed up for comments.
Good evening. My name is Wanda Bowman. The last board meeting I asked the same question. I'm going to ask it again tonight. We still haven't received an answer. On April 17th, 2018, Complete Healthcare Services and Dr. Martin Gilliland received a loan from the Jasper Memorial Hospital Foundation in the amount of $342,000 with an annual interest rate of 5%. The principal amount was dispersed to the borrower in the form of a line of credit. This was taken out in installments. 2 draws were done on April 17th, one in the amount of $110,785 and one in $64,553. 2 draws were taken out again on June 1st. Both of those draws were $64,553. On the last draw, August 1st, just 1 month before the loan was due, a draw was taken out of $37,558, and that would have totaled, or did total, $342,000. All the collateral shows is office supplies, such as waste paper baskets, plastic and metal, plastic trays, soap dispensers, bulletin boards, a couple of ladders, medical supplies, an AT&T unlimited SIMS card with 2 months left of access on it. My question was, has this loan been paid back? It was due September 1st, 2018. I don't understand the board's policy of not answering questions to the public when they do ask. Mr. Brooks was so kind as to give me his email address so I can ask the question in writing. I sent the email on March 21st. He responded on March 25th, real promptly, advising me that he was giving it to somebody else to answer. Haven't received an answer. I sent a second email on April 4th, a third email on April 8th, and then again, 4th email on April 12th. Still have not received an answer from anybody. So I did file a complaint with the Attorney General of Texas on the Open Information Act, and still have not received a response. And again, I don't understand the board's policy of sitting there and not saying anything when people are asking and talking to them.
He forwarded your response to me, and I'll be making a report tonight in my attorney's slot, so you'll hear your answer tonight.
Wonderful. It would have been nice to at least got an email saying that I have received it and am working on it.
And one other thing that you need to be aware of is that the Jasper Hospital District, Jasper Memorial Hospital District Foundation is not a governmental entity and is not subject to your request. But we are going to respond to your request and give you the answer that you were seeking.
Thank you very much.
Yes, ma'am.
At this time, we'll move on. New business that is done. Consent agenda item, we only have one.
Mr. Chairman.
That is to.
Mr. Chairman. Could we poll the members to see who was provided an information packet for this meeting and who did not?
We sent everybody the information packet.
Never received nothing at my home address or office address. I'm going to guess that I'm the only one that didn't.
All 9 board member packets were mailed out at the same time. However, there were 1 or 2 that were in the office, and those were hand-delivered to them. I apologize to you if you did not get yours. You did not call us about that, or we would have supplemented that. But they were all sent out. There was no intent to create a problem for you, and I don't think that you've had that problem before.
I have not, and I appreciate your apology. What I would like would be a copy of the agenda and the items that we're going to discuss that were in that packet. so we know what's on the agenda, and we would have several days to make amendments to the posted agenda, should that be necessary. The actual official agenda has to be posted for 72 hours. And if we get notice of the meeting and what's being planned, then we have time to say, hey, there's something that we need to add or modify. So I'd make a motion that we send our, make sure our members get their board packet received 1 week prior to the meeting. Thank you.
One thing I know, one thing before we talk about it, something you said financial.
Here's the problem that we run into. When the board meeting is, I'll say early, because it is earlier than normal, we don't always get the information for the financials. And we held off to the last minute to try to get the financials to include in the board packet. But they still went out on time. But if you put a week or something earlier than that, that's very difficult, if not impossible, for us to have the financials to you.
A note to that effect should be sufficient. You know, we regret that we cannot find the financials, and then the board can take action as to find out why not. We have to have a discussion with our depository and see if we could not motivate them to provide those earlier.
The depository has nothing to do with it. They have minimal to do with it. We have to wait to get the bank statements from the bank. We then have to email those to BKD, and then BKD has to get that back to us. Sometimes we're a day or two short, and in other words, we may have a meeting on the 21st or the 22nd, rather than today, maybe it was 16th or 17th.
Mr. Jackson, why don't we just make it an agreement among the board that we have our meeting on the 3rd Tuesday of each month? Is that correct? The notice goes out at least the Friday before.
That's what we do.
And if any board member hasn't gotten their packet, they can go to your office and pick up a duplicate copy of their packet.
Easily able to supplement, and we have had that. That's not going to be the first time this ever happened, and sometimes someone would call and we would get.
So if a board member doesn't get the packet by Friday, they can go to your office and get a copy of the entire packet.
Well, they wouldn't. If you're going to mail it out on Friday, if that's what you're saying, they're not going to get it by Friday.
Well, I understand that. But if they need 3 days' notice to be able to have information for the meeting, they can go to your office and get it. Is that
We will go with whatever y'all want to do. Yes. I mean, like if you're on Monday or Tuesday of the meeting and haven't got a packet, we'll be happy to furnish a supplemental packet. The problem we have is getting we want to send it out complete, and we don't always have the agenda finalized early enough to, and if we're doing Wednesday or Thursday, is that time frame that we're doing it. We get the financials usually in that same day or two, and then it's all sent out. So it's either sent Thursday afternoon or Friday. That usually with our mail, local, usually sufficient to get it to you either on Saturday or Monday, and for sure on Tuesday. I don't know why he didn't get it.
Well,
I'm not in a position to say he did or did not get it.
I'm just saying if you don't have it by Friday, you can pick it up on Monday.
I have no problem with that.
Okay.
If you don't have it on Monday, give us a call, and we'll get you another one to you. Has anybody else had that problem? You had a problem?
I've had that problem, not very
I
often.
mean, but I mean, like this week, this month, did you have that problem?
No, I got mine on Monday.
Mike, did you have the problem?
No, I've got mine.
Kenneth, did you have the problem this month?
You know, got mine Monday.
Ace, did you have a problem this month? Reverend Hart, did you
There
have a
have
problem?
been times I met maybe once in maybe 18 years, once or twice.
Just
I've
kidding.
always got mine, this one I got Monday.
It looks like to me you're trying to strain an ad, but I'll work with you. You've never had a problem coming to my office, so if you don't have it, call me.
You have a very nice office. It's very accommodating, and I appreciate your support. Always always been treated very well.
Just
I appreciate
call
that.
me, I'm happy to supplement it, that's not a big deal.
There is a motion on the floor that we send out these packets so the board members will have at least a week to review it prior to the meeting. The problem with the financials can be solved by providing a directive to our depository. Had this board been following state law and getting bids,
I tell you what, so we're not gonna go to all that. We have a motion on the floor to have
condition and
the
bid
minutes,
could
we
say
have appointments
we
tonight,
need
we can,
financials by a certain
we have a
date.
second,
Thank you.
we have a second. We don't have a second, the motion died from the lack of a second. Dr. McMurray, you are more than welcome to contact Mr. Jasper and get your packet together, got it, for Friday.
So may the record show that the board refuses to provide members
The
with
board did not refuse to provide you, we just told you come get your packet.
in time for the board members to actually review it. You're
You
not
need,
allowed
you need a whole week,
time
you
to
need a whole week to review, you just said,
We need time before
We're gonna move on.
the actual
we're
notice.
gonna move on. Okay, the next item on the agenda is the committee reports for the board to take any action if needed. At this time, we have a finance committee. Yes, ma'am.
All right, first item, number one, an audit ending 6/30/2018 of Apr Jackson.
We're coming down to the end of that. In fact, I've received my letter, my litigation letter that always comes out near the end of any kind of audit. We prepared that and getting ready to return that, so I know they're coming down to the end of their work.
Thank you. The next item is the financial statements for March 2019. I reviewed the bank statements and the financial statements for March 2019. The bank statements have been reviewed, and there's an outstanding check for $97.50, check number 2632, this is for a meal strategic planning. I reviewed the financial statements and the bank statements, and I'm making a motion as presented to approve these statements.
Second.
We have a motion by Mr. Matthews to approve the financial statement for March 2019. We have a second by Ms. Harris. Any more discussion?
Yes, thank you.
And I'm gonna interrupt you like you interrupt me. If you're gonna state the same statement, I would like to make that the record show that, in the previous minute, that if your statement is done for the same, that we recognize that you abstained based on the fact that they haven't been audit. And that would save you some time and week break.
Mr. Chairman, you have no idea how encouraging that is to me that we've actually paid attention to something I said.
Okay, so
Thank you.
with that being said, I'm
But
gonna
that
move
happens
on
not
from
to
it.
be-
If that is something different, I'll listen, but
It's
not,
some-
okay, all right.
It's something different.
Okay, all right, thank you.
On the minutes of the last meeting, I had a comment by Mr. Jackson that BKD was working on the audit. They had requested a large list of items so they could do their audit. I'd like to see that list. Okay, I'll stop by and pick it up. Thank you.
So we have a motion and second, any more discussion? If not, all in favor say aye. Aye. Opposed likewise?
Nay.
And all nay?
Okay, item three.
Motion passed. Before you move any further, can I interrupt you for a moment? I kind of apologize, I got kind of threw off track here. Let's go back to the minute. We have a motion to approve the minute.
I like that one.
Have a second?
Second.
Have a second. Ms. Matthews. All those in favor say aye. Aye. Opposed likewise. Okay.
The next item is review the TLRA collection reports. We do not have a report. But going to item 4, we did receive a check for $7.63 for March 2019 for a tax collection. 31st, 2019, that was $950. I'll bring this as a motion.
Second.
We have a motion by Mr. Matthews to approve BKD invoice for $950. Have a second by Mr. Ratcliffe. Any more discussion? If not, all those in favor say aye.
Aye.
Opposed, likewise. Mr. Matthews.
All right. Next item is discuss and approve payment of BKD. This is for the audit of the financial statement for the year ended 2012-2018, and for the preparation of adjustments and analysis of accounts that are required, the amount of $6,240. I'll bring it as a motion.
We have a motion, Mr. Matthews, to pay BKD in the amount of $6,240.
Second.
Second by Michael Ratcliffe. Any more discussion? If not, all those in favor say aye.
A discussion, just to make the comment that those charges are excessive, I'll be voting negative, that's all.
Once again, all those in favor say aye.
Aye.
All those likewise.
Nay.
Motion carried. Next thing we have on the agenda is the Building and Grounds Committee. Ms. Harris.
The only thing I'd like to report is that Air Rescue, if you'll remember, I've talked to you about people going on the helicopter pad, and they're paying to install some shrubbery around it, and that should be going in probably within the next 2 to 3 weeks. They decided to do the shrubbery that way, just in case the rotor did happen to get over into it. It trims the bushes versus tears up the aircraft. So you may notice in the next couple of weeks some shrubs going around it, and it's going to create about 2.5 to 3 foot little wall around there.
Excellent.
You need some shrubbery? I just dug up 16 plants that I trimmed about chest high, so Lily could plant some flowers under there.
So you can put some more shrubbery out.
Yeah, I got some if you want them. They're ready to plant.
Okay.
Next thing we have is the Quality Assurance Committee. There's nothing. Pension and personnel.
I don't have no report. Pension's no good.
Pension no good?
I won't even consider the personnel thing. That's no report.
Okay. Insurance Committee.
We have a bond renewal statement from Lester's Insurance of $450. I make a motion that we approve it. Now, the bond renewal with Lester's Insurance needs to be corrected as far as the board members that are being renewed. Charles Nicholson needs to be removed, and Ron McMurray, MD, needs to be included. Otherwise, the bill looks like it's intact, and I make a motion that we go ahead and pay it, subject to that correction as to the bond renewal effective May 15th of 19 for L. Matthews, Kenneth Brooks, Mike Ratcliffe, John Horton, Deborah Harris, and include Ron McMurray.
So moved.
Thank you.
We have a motion to approve the bond payment of $450.
Second.
With pending correction, modifications that were stated. We have been a second by Ace Matthews. Any more discussion? If not,
Have we ever given any thought to asking for bids from various companies? How many companies were contacted when we sought this coverage?
It's $50 per board member, and to my knowledge, it was always with Lester Insurance, and that is a very reasonable amount. As a matter of fact, it's a low amount. And the next time the renewals come up, we will submit to bids, if necessary, for a $50 bond renewal. And that's all I can report.
Very helpful, thank you very much. I think anything that we do in this community, we need to be able to show how we're spending the money. We need to make sure that other entities in our community or surrounding community will have similar access for any business that we might generate.
Do you want to distinguish for us how we're going to distinguish between multiple $450 bids?
I'd be happy to help.
I'm not asking for your help, I'm asking for your input as to how you would like to see us distinguish between 3 or 4 different bids, all for the same amount of money.
The bidding process involves an advertisement in the local newspaper once a week for 4 weeks, and on things that we are actually required to accept bids on. There's probably not a legal requirement that we specifically spend it on this.
There is no requirement that it is, but you still are avoiding the answer to the question that I asked.
No, sir.
Yes, sir, you are.
I'm trying to
I'm trying to get you on path here,
the
Ron.
way, once the bids are obtained, they are to be opened in an open meeting. And at that point, any board member could comment on which bid they favor.
So you
And
have,
it would be.
so you have no, that's what I thought. Thank you.
Well,
We have a motion by Mike, we'll go back again, second by Matthew. We have some discussion about Apr heard. We move to a vote. All those in favor say aye. Aye. Opposed likewise.
I won't say aye to oppose, I'll say nay to oppose.
Strategic Planning Committee, have anything? No report. No report. The president report, I have nothing to report at this time.
That would be me, yes.
Come on up, Mr. Mike.
Absolutely, thank you very much. So Robert, I wanted to give you this. This is what you requested last time. That's what I'll be doing now.
That's great.
Okay? So I'll go over the highlights of the month of March, our month end. Our total operating revenue was a little over $2 million. A little bit short of budget by about $82,000. Our operating expenses were about $2.2 million, a little below budget. All that came out to about a $90,000 loss for the month of March, $156,000 below budget. That brings our year-to-date through March 31st as a loss of $60,000. That is below our budget, but it's also about $250,000 better than we were this time last year. So making some progress. Two main causes for the loss for the month of March was voluntary free care, which is driven by self-pay and the ministry work that we do, was above budget by about $339,000, and salary expenses were over budget by about $66,000. Our average daily census for the month was nearly 7. That's almost 1 higher than our yearly average of 6. There were no inpatient surgeries for the month. It was a spring break month. Our general surgeon did take some time off at that time, as well as some of our associates. Outpatient surgeries, number 8. That's just below the monthly average year to date. And that number is still impacted by the retirement of Dr. Botras. The number of patients admitted to the emergency room for the month was good. It was 57. That's 12 more than our monthly average through year to date, which has been 45. Emergency room visits for outpatients were about 1,700. A little less than budget by about 200, but still it was a spring break. And the flu season hasn't been as bad this year. We've had pockets of it, but it hasn't been as prolonged as it was last year. Outpatient visits for radiology lab, a little over $5,600, a little less than budget, but on track with where we've been running year to date on a monthly basis. Our payer mix is somewhat of a concern. Our commercial is down by a little over 0.5%. Medicare, traditional Medicare, is down 2%, but we see that kind of transitioning into managed Medicare. Our managed Medicare is up by about 1.8%. A little less reimbursement value on the managed Medicare than traditional Medicare. That's why that would be a concern for us. But we also know that as time goes, there's going to be more and more of that. Self-pay is up by almost 0.5%. average length of stay is very good, though it's trending up a little bit. Average length of stay was 3 days. We've been averaging historically about 2 3/4 days stay. I suspect that the lack of OB services right now, or the lack of that volume, is probably driving that average length of stay up a little bit. OB services still continue to be a work in progress. We still have 2 physicians in the market that are helping us with call. The investment for that for Christmas is about $30,000 a month. We've talked about the two proposals that we went out and got for the OB hospitalists that they're not feasible, about $2 million a year on each one of those. Our system is, just a little bit of editorial here, our system sees that there is a critical issue going on with obstetrical services throughout our system and likely throughout the nation. As younger physicians, as we call them millennials, are graduating, coming out of their internship and everything, and they're choosing OB services, they tend to want to not do the deliveries in the hospitals. They want to see their patients and do the prenatal work and the postnatal work. So it's beginning to create an industry of OB hospitalist programs. And that's something that's really kind of new it's real new for our system. It's fairly new for the nation. We have hired a gentleman, Dr. Wayne McFarley, that is working for our system, but he has been, I have reached out to him, let him know what kind of situation we've got here in Jasper and how dire it is and how we really need to get something going that works for all of us. And he actually came to Jasper yesterday, met with Dr. Pham, Dr. Gilliland in person, and Jane, our CNO. I was in Beaumont on the phone talking with him as well. He sees the issues that we've got and says, there's not going to be a real fast, easy solution. He says it's not going to be cheap. He says it's not going to be $2 million a year. It's not going to be $1.5 million a year. It's probably not going to be $1 million a year. But he did say that he would put some numbers together and kind of put some ideas on paper for he and I to kind of get back with the physicians in a week or so, or at least by the end of this month, and be able to continue to figure out how we can make something that works for all of us. I met with Dr. Farley twice now, and he's actually coming in to work with our OBs at St. Elizabeth next week as well. Seems to be extremely knowledgeable, seems to really have a passion for what he's doing, and hopefully will present us some really good help.
Is that F-A-R-L-E-Y?
Yes, sir. Yes, sir. And it's on the second page at the top, Dr. Wayne Farley. So, 2 other things. We have just put in a request to replace all the endoscopy equipment at Jasper. That includes the scopes, the endo system, the monitors, and all that. It's about a $162,000 investment. Locally, we approved that on a regional basis. We've sent that to our system office. I expect to get the approval for that in the next couple of weeks. So that'll be a real plus. The scopes we're using now are only 3 years old, but they've been very problematic, and something that Dr. Hoyt and I have been working to try to get replaced. We have a lease for it. The lease has run out, so now we've got kind of a window open there where we can purchase those scopes. I suspect our system office will approve it. Also in the works is a $500,000 capital investment that we would like to do in our telemetry monitoring at the hospital. Telemetry is, what they hook you up, they listen to heart, monitor heart, patients and so forth. We would like to be able to do that throughout the facility. We have a very old telemetry system now. We would like to upgrade in our med-surg area, our day surgery area, and then the emergency room area. That's still a work in progress. I think by the end of our fiscal year, which is June, we should have a completed capital request that we will submit both regionally and to the system. I think our system's got to push for all of us to upgrade to this new telemetry system. So I think we'll get it approved. We just have to make sure we get what we really need. So that's my report. Any questions? Yes, sir.
Would you explain to the board the interplay between the various payer mixes and what happens when one up or slightly down in relationship to the others?
Sure, it's really, I mean, to boil it down to simple things, it's really about the money. Commercial insurance is obviously still your best payer. If I've got commercial insurance going up, I've likely got either Medicare, Medicaid, or self-pay going down. All those are inferior payer bases to commercial insurance. We see a fairly high self-pay percentage here, running almost 15%. It's not uncommon in our region to run those types of numbers, but that's pretty high numbers. And mostly the self-pay is, that's what drove our voluntary free care this month, a $339,000 hit there. That's just basically care that we've given away.
So what you're saying is self-pay equivalent to low pay, or is it equivalent to no pay?
Both, really. If someone comes in and has the ability to pay and is willing to pay, they don't have any insurance or whatever, if they can pay something, we'll collect something. But if they're completely indigent, we'll try to find them Medicaid, we'll try to find them whatever program services we can get them. But yeah, it's low pay to no pay. Yes, sir.
Have you had any measles outbreak or measles?
Have not. We have not. We've had a couple of issues, or not issues, we've had a couple of scares. I think some of it hit the news in Beaumont. Both cases were not the measles. Yes.
Thank you very much. A great report. I appreciate the effort that you put into that and coming here and talking to us. And I've just a real question. Could you update us on the patient satisfaction rates? Any new data?
I'm so sorry, I did not put that in here. We actually, we're actually doing extremely well in our emergency room. And you're going to ask me for exact numbers. It's above our goal, and right now I can't tell you what those exact numbers are. Our inpatient is what is the most concerning to me because it's not achieving goal. But this month, I guess probably month before last, we had a little uptick in inpatient. We got really excited, and the next month it kind of flattened out. We're beginning to see that uptick again. We're really, really trying to get those things up. We're trying to make sure that we walk into the rooms, make our rounds, do our rounds with purpose, make sure we're washing our hands and talking about that and talking about positioning of the patient and just the clear pathways for the patient and making sure that they know that we're there for them. We did see a good uptick this month. Our monthly numbers in the satisfaction are well above goal. I think today at the huddle they were 80, that's what I was going to say, 80%, which is really good. Still puts us at about 69% for the year, which is about 1% below our goal. I think, though, that we have a really good chance to get to our goal before the end of this fiscal year.
Is that based upon forms submitted by the patients or their families? And if so, are those forms delivered while they're still in the hospital leaving, or is it always by mail afterwards?
It's always by mail afterwards. It has to be by mail afterwards. And on the inpatient side, it's based on HCAHPS, which is a CMS or a Medicare-based patient satisfaction survey that's given.
So actually, a patient could have been very satisfied with your services. They just didn't get motivated to send the report back.
Yes, that's very true. And again, the way that CMS looks at this or Medicare looks at this, they want to know what percentage top box you got. And top box score is the highest score you can possibly get. One down below it is not a top box. So, unless they check that very top box, they can be extremely satisfied with you and check that second to the top box and you don't get benefit. So it's tough. It's really tough.
Thank you.
I personally appreciate the effort that you're putting into that.
Yes.
Another question, looking at for the year, 60,000 or more loss. If we kind of look out around us, by my estimates, we have a third or less than the number of primary care physicians that we really need in this area. if that problem were solvable, and I think it is, and the board took direct action and ownership of that problem to work on it, and we doubled the number of primary care physicians, what do you think would happen to that $60,000 loss figure?
Well, I think it could go, I think it would certainly get better, providing that we recruit right and we position the physicians correctly and set them up to be successful.
It is my personal belief, not that of the board, that we have sufficient resources to do a heck of a physician recruiting campaign. And I'm trying to make that point everywhere I can. And there may be a time when we are able to put that in place and put significant resource into it, and we would definitely want your input on the way we go about that. Mr. Wayne McFarley.
Yeah, I said McFarley first, it's Farley, just with an F.
All right. Well, that's too bad. I thought you might have been relevant. Would you object if I had a meeting with him? Could you set that up? I'd like to sit down and visit with him.
I'll try to set something up. I understand he's hitting all of our facilities on the domestic side in the United States. So he's going to be here for a couple hours Tuesday night to meet with the OB physicians in Beaumont. I don't know what his calendar looks like beyond that. I can certainly ask him.
I wonder if I can meet with him after that meeting, hang around, I can get to.
I'll certainly ask him, sir, but I can't promise.
Or if he has any other suggestions, and I'd be happy to travel to anywhere in Texas or the surrounding states.
Sure.
Thank you.
I'll let him know.
Let me ask you a question.
Yes, sir.
Physicians recruitment that Mr. McMurray referred to, as there has been an attrition of local physicians, Dr. Botris is a good example. He was a good surgeon and now he's retired, so to speak.
And enjoying himself, by the way. I visited with him.
Over the years, as the physicians have began to decrease in this general area, as the physician recruitment into this general area to get primary doctors here, who benefits from that from a hospital standpoint?
But what we've done,
Just a simple question. Economically, who benefits?
Everybody benefits.
Well, I
The
know.
community benefits, the hospital will benefit, everyone benefits.
Okay, but, if we are landlords renting a building and you are managing the hospital, the more physicians you have coming into the community to put patients, inpatients into the hospital, whether it be for deliveries with an OBG doctor locally, or whether it be for surgery, it would be Christus' benefit financially for these physicians to be in this area. From a hospital management standpoint, would you agree with me?
Not completely. It's a philosophical argument.
Sure.
I could sit here and tell you that without we've had 4 deliveries over the last 2 months. Typically, we've been having, before that, average of 15, 16, 17 deliveries per month prior to that.
Okay. And so
More than half of those deliveries, I can document, have gone to Beaumont. Okay? So we've gotten the economic benefit of it without physicians here.
but not this hospital.
That's not the question you're asking. Who benefits?
This hospital.
This hospital is Christus if we're running it.
Well,
Again,
I'm not
philosophical.
talking semantics, I'm talking
No,
about.
we are. At this point, we are.
I'm talking about your budget for this hospital and maintaining that.
Have a regional budget.
Okay, that's.
Again, we're talking philosophical, and once we get down and sit down and talk about the negotiations, I don't know if he's shared the letter with you yet, but Paul has responded. Once we sit down and discuss all that, then we can discuss those.
Okay.
I need physicians here. I want to recruit physicians.
Okay.
I don't want to ship my patients to Beaumont, but I gotta make it feasible.
Okay, that's all I have. Thank you.
Okay, you do. Anything else?
If you
Just
not comments, I appreciate the way you handle that. Mr. Ratcliffe, mentioned Dr. Potras. He's retired. He left an office fully equipped, and it's designed for 4 physicians, 4 primary care physicians.
Yep.
Could move in to Dr. Potras' old office. This board could purchase that from him or lease it. And we could put 4 new positions in that area, according to my plan, in 6 to 9 months. I'm the only one working on it, so it may be a while. But I sympathize with you 100%. I'm going to do everything I can to get you some more dollars.
Yes, ma'am.
As you know, there's a new company coming into Jasper that's going to generate quite a bit of employees. If they happen to, and I don't know if we know what insurance they're going to have. Okay, so that's one we take. How would that affect as far as revenue coming in?
Oh, it probably, it would probably do great. In fact, they're probably going to obviously hire locally. So if it's folks that are on Medicaid now or uninsured and they're insured, absolutely that would help.
Okay.
Would change that payer to the extent they need hospital service.
Okay.
Let's throw just a little twist on
Yeah.
it. There are some larger employers in town that provide insurance for their employees, but it apparently is through companies that does not have a working relationship with Christus.
Is it
How do we-
Cigna?
How do we fix that?
Yeah, so that is an issue that's pretty tough. Cigna, several months ago, our system-wide contract with Cigna was coming to an end. Typically, you get, when you renew these things, you typically get a market basket adjustment, which is a cost of living adjustment. They typically look at different services, and they just adjust prices for different procedures. When Cigna got done with what they wanted,
Cigna has problems nationwide.
when Cigna gave us the proposal back to us, and the insurance companies are tough to negotiate with. When they give you numbers, it's where it stays 9 times out of 10. And what they were looking at giving us was a big cut to our entire system. So our system stood their ground and said, you change this, or we're going to let you lapse. And that's what happened. We lapsed a couple of months ago, where we no longer are in network for Cigna. Negotiations continue. I understand our hospitals in Tyler, which actually had a earlier expiration date than the entire system did. I understand they have signed an agreement, so they're back in network. We are keeping our fingers crossed that they're going to get something for the rest of us. What we're doing this down in Beaumont as well, and can't do it legally and above board, but on a case-by-case basis. Let's say we have somebody that comes in that came in through our ED, it's emergency basis, obviously they're covered, but they have to be admitted inpatient. And they want to be admitted here. All of a sudden, it's no longer an emergency situation, so Cigna is now out of network for us. Most of these folks have no benefits out of network. What we're doing is we're working with those folks and saying, what would your benefit have been if you were in network? What would have been your copay at that point? And that's all we're asking for. So we're trying to make it good on them so we can keep that business. We're doing that in Beaumont as well. Do that on surgical cases, outpatient cases, and so forth. We are are told that part of the negotiation process is that when they do sign, and I do believe we're going to end up getting to an agreement, that Cigna will go back and retro all of that. So everything will be good. That's why we feel comfortable going to these patients and saying, you know, what you would have owed if we were in network is fine.
But
Yes,
when you tell me though, they have to go 2 moments now, and they
no,
go to jail.
no, I do that here. In
Okay.
fact, we've done it several times.
Yes, sir.
It's my understanding that Blue Cross is now opening up some of their own clinics in the state of Texas.
Blue Cross, I had not heard that.
And
I don't know.
And I was wondering if that's, well, you're not going to know the answer, but I guess that if Christus has faced that issue in any of their markets yet, and if so, how did y'all address that?
I'll find out what experience we have with that, but I have not heard anything.
These were around the Dallas area.
Okay, we don't have any
No,
facilities in Dallas. That's the weird thing. Our corporate offices are in Dallas. We don't have any health care. We only have physician practices in Dallas. Also, Cigna, through this whole process, we're being told that 3 employers in the state of Texas, I don't know where they're located, they're obviously not in our region, but 3 employers have dropped Cigna over all of this. Cigna's hurt. That's right.
I'm surprised.
That is some good information about working with the ones here. I'm just trying to get the word out to them, some kind of way.
Yeah. And, you know, we just can't openly
Okay,
advocate.
I can't open it, okay.
But word of mouth is awesome.
Is there something that, any communication from you to the local employer?
I can't do that. If Cigna knew that we were doing that, it might hurt.
Well, no, it don't hurt you by saying it in
That's correct.
this open form.
No, I'm fine.
Okay.
Thank you.
You bet. Thank y'all so much.
Thank you, Doctor.
You bet.
Training report.
With regard to the, we received communication from the Texas Department of State Health Services that they have issued a check in the amount of $1,542.08 to the district for its 2019 pro rata share of the tobacco settlement proceeds. With regard to an inquiry that was made last month regarding Dr. Gilliland's relationship with the district, I went back and created some information for my use that indicated that he is timely paid to the district its monthly rent from May 1 of 2018 through April 1 of 2019, the amount of $3,473.58 each month, which is the same rent amount that was paid by Christus for the Rayburn Rural Health Clinic. And likewise, he has paid the interest on the note. The 5 notes that were mentioned were always intended to be renewed in a master note. That was done in November, effective November 1, 2018, and interest has been paid currently monthly since that date. That concludes my report.
That's to the foundation.
That's to the foundation, it's not to the district.
Okay, thank you. At this time, I'll have to entertain a motion to adjourn. Motion by Cliff, no second. By Ace Matthews. We're on adjourn, the time is now 7:27. And we'll be back into the foundation meeting. Same time, 7:27. Call order the Jasper Memorial Hospital District, Hospital Foundation, not district, but Hospital Foundation. Meeting to order just 16th day of April. First item is to approve the minutes for May March 19, 2019. Have a motion?
Second.
Have a motion by Mr. Becker, second by Mr. Matthews. Any discussions? If not, all those in favor say aye. Aye. Opposed, likewise. Yes, unanimous. Under the mayor's report, we got financial.
All right, I reviewed the bank statements, financial statements for the Jasper Hospital Foundation for March 2019. Reviewed them, and I'll make a motion to accept them as presented.
Second.
Have a motion by Mr. Matthews, second by Mr. Matthews to approve the financial statement for March 2019. All those in favor say aye.
Aye.
Opposed, likewise.
Nay, you don't have an opportunity to see.
Motion nay. On old business, there is none. On new business, there is none. Mr. Johnson.
Mr. Chairman, I would like to get a copy of the foundation's organization, constitution, and bylaw.
We are the most adjourned, I'll do it. We have no other adjournment, but I'll do it.
I'll make a motion to adjourn.
Who's always there?
I'll second.
Motion by Mr. Becker, second by Mr. Matthews. Get put by Mr. Jackson's office.
All right. What would be a good day?
It's 7:29.
Just call me. You know, the town hall.
Should be back, probably Monday, Tuesday.
That's fine. Just call me when you're back. I'll go and start looking.
All right. What number would you prefer me to call?
384.
384, I'm sorry,
542.
Thank y'all, folks.
Thank you.
Have a safe trip back.
You bet.
Thank you.
That's it, all right.
Trying to, man, trying to. Y'all have a good night.
All right.
I think that was the package.
Good. Who's gonna get it?
Huh?
Gonna get it, Aurora? Who gonna win it?
Which one?
It's gonna be between Houston and Aurora.
Well, I hate to say it, but I think it's gonna be New Orleans. New Orleans.
Not even good. No. They ain't make it to NBA. They didn't make it to, they didn't make it to the playoff.
I'm still so disappointed in Texas Tech.
Why did they lose? Why did they lose?
Because the referee did not give them the call that they should have had down there, which was put over the top. After they played over and over, and over what they called, they were absolutely, that ball that she was, he knocked him, his body knocked him over, that whole back. Didn't even call it.
Same thing, they did the same thing last year. I did. I'm hoping. I was hoping that it Houston, that three-point shooter, what's in that Curry? We have that baseball. Yeah, I love it. That's my cousin. But my sister over here.
That's what he's a ball player. Yeah, and he's not no 6'8" guy, he's
About 6 foot.
that's probably 6'4", yeah. Oh, he can shoot that ball.
Got the left handed.
Yeah.
Yeah, that
Don't forget you had the photo over here.
You're all going to get your head over here.
Okay,
That's right, we should start at 9.
But I think it's gonna be Houston and New Orleans. Houston and New Orleans, I think it's gonna be in the playoff.
Yeah.
A final analysis.
Well, I'm afraid that San Antonio is gonna make it.
I wish you would.
I don't believe this year, oh, maybe next year.
No, we already gonna make it. I don't need a San Antonio. No.
I've been busy all day, man. Busy all day, so. Well, hold it in your hand.
All right, I got it.
Hey, Brad, what do you send me that money for? I was gonna buy you lunch out there tonight. You afraid you gonna be dead in a minute or what?
No. I was walking out and said, I ain't got no money, all I got is credit cards. They didn't take them out at Catholic. And Mike poured it out and said, here's $10, get you one. And thank you very much for the loan, I want to pay you back.
Well, what I gonna tell you is, I missed to buy you lunch. Okay, since it's long, I'm gonna need a little interest.
I may have a little change for $10. But I do appreciate it. I wanted to get it to you first thing Monday morning. I ate it all weekend. I get it, and then I eat it Saturday and Sunday and everything else. Appreciate your help. And Friday when I went out there, I damn sure had cash. Okay.
I didn't get to go Friday because I had to go to ball game. We worked too hard. I think you were around.
All right, good night, everybody.
Let me eat that in there. You worked too hard on it today. See y'all later. Hey, you call me if I get.
You got everything signed? You got everything?